Discover the various benefits and potential adverse effects of Eliquis, a commonly prescribed medication used for a range of conditions. Whether you're seeking information about Eliquis for personal knowledge or considering it as part of your treatment plan, understanding its common purposes, dosage guidelines, and dangers is vital. In this video, we will delve into what Eliquis is used for and shed light on its potential benefits and risks. Eliquis, or apixaban, is a blood thinner primarily prescribed to prevent blood clots in people with atrial fibrillation, a type of irregular heartbeat. Additionally, it is used to treat and reduce the risk of blood clots in certain individuals who have undergone hip or knee replacement surgery. However, it's important to be aware of potential adverse effects, such as excessive bleeding or allergic reactions, and to discuss any concerns with your healthcare provider. By examining the common purposes, benefits, potential adverse effects, dosage guidelines, and dangers of Eliquis, you can gain a comprehensive understanding of this medication and make informed decisions about your health. So, let's explore the world of Eliquis to ensure you have the knowledge you need. Common purposes of Eliquis. Eliquis is commonly prescribed for two main purposes: preventing blood clots in people with atrial fibrillation and reducing the risk of blood clots after hip or knee replacement surgery. Atrial fibrillation is a condition characterized by an irregular and often rapid heart rate, which can lead to the formation of blood clots in the heart. These blood clots can then travel to other parts of the body, causing serious complications such as strokes or pulmonary embolism. In patients with atrial fibrillation, Eliquis helps to prevent the formation of blood clots by inhibiting the action of certain clotting factors in the blood. By doing so, it reduces the risk of strokes and other clot-related events. Additionally, Eliquis is prescribed for individuals who have undergone hip or knee replacement surgery to prevent deep vein thrombosis, DVT, and pulmonary embolism, which are common complications of these procedures. Benefits of using Eliquis. One of the main benefits of using Eliquis is its effectiveness in preventing blood clots. Clinical trials have shown that Eliquis is superior to other blood thinners, such as warfarin, in reducing the risk of strokes and systemic embolism in patients with atrial fibrillation. It also has a lower risk of causing bleeding in the brain, which is a potential side effect of some other blood thinners. Another benefit of Eliquis is its convenient dosing regimen. Unlike warfarin, which requires regular blood tests to monitor its effects, Eliquis does not necessitate routine monitoring. This makes it a more user-friendly option for patients, as it eliminates the need for frequent doctor visits and blood tests. Furthermore, Eliquis has a relatively quick onset of action, meaning it starts working soon after ingestion. This is particularly important for individuals who have undergone hip or knee replacement surgery, as it allows for early protection against blood clots. Potential adverse effects of Eliquis. While Eliquis is generally well tolerated, like any medication, it can have potential adverse effects. The most common side effect of Eliquis is bleeding. This can manifest as nosebleeds, bruising, or prolonged bleeding from cuts or wounds. In some cases, bleeding can be severe and require medical attention. It's important to seek immediate medical help if you experience any signs of excessive bleeding while taking Eliquis. In rare cases, some individuals may develop an allergic reaction to Eliquis. Symptoms of an allergic reaction can include rash, itching, swelling, severe dizziness, or difficulty breathing. If you experience any of these symptoms, it is crucial to seek emergency medical attention. Other potential adverse effects of Eliquis include gastrointestinal disturbances, such as nausea or stomach pain, and anemia. However, it's important to note that these side effects are relatively rare and usually not severe. Dosage guidelines for Eliquis. The dosage of Eliquis prescribed by your healthcare provider will depend on the specific condition being treated and individual factors such as age, weight, and kidney function. For atrial fibrillation, the recommended dose is usually 5 mg taken orally twice daily. However, your doctor may adjust the dose based on your specific needs. For individuals undergoing hip or knee replacement surgery, the usual dose is 5 mg taken orally twice daily, starting 12 to 24 hours after the procedure. It's crucial to follow your healthcare provider's instructions regarding the dosage and duration of Eliquis treatment. Do not stop or change the dosage without consulting your doctor, as doing so can increase the risk of blood clots or other complications. Dangers and precautions when using Eliquis. While Eliquis can be highly beneficial, it's important to be aware of potential dangers and take necessary precautions. The most significant danger associated with Eliquis is the risk of excessive bleeding. Since Eliquis is a blood thinner, it can increase the time it takes for blood to clot. While this is desirable in preventing blood clots, it also means that even minor injuries can lead to prolonged bleeding. To reduce the risk of bleeding, it's crucial to follow your doctor's instructions carefully. Avoid activities that may increase the likelihood of injury, such as contact sports or vigorous physical activities. If you experience any signs of bleeding, such as unexplained bruising, blood in the urine or stool, or excessive bleeding from cuts, seek medical attention promptly. It's also important to inform your healthcare provider about any other medications, supplements, or herbal remedies you are taking, as some of these can interact with Eliquis and increase the risk of bleeding or other side effects. Additionally, if you are scheduled for any surgical procedures or dental work, make sure to inform your healthcare provider and dentist about your use of Eliquis. Comparing Eliquis with other blood thinners. Eliquis belongs to a class of medications known as direct oral anticoagulants, DOACs, which also includes other drugs such as rivaroxaban and dabigatran. Compared to traditional blood thinners like warfarin, DOACs have several advantages. They have a faster onset of action, do not require routine monitoring, and have fewer interactions with food and other medications. However, the choice between different blood thinners depends on individual factors and the specific condition being treated. Your healthcare provider will consider factors such as your medical history, kidney function, and risk of bleeding before deciding on the most suitable blood thinner for you. Important considerations before starting Eliquis. Before starting Eliquis, it is crucial to discuss your medical history and any underlying conditions with your healthcare provider. Inform them if you have a history of bleeding disorders, liver disease, kidney disease, or any other significant medical conditions. Additionally, disclose any medications or supplements you are currently taking to avoid potential interactions. Pregnant women or those planning to become pregnant should consult their doctor before starting Eliquis, as its safety during pregnancy is not well established. Similarly, breastfeeding women should discuss the risks and benefits of Eliquis with their healthcare provider. Frequently asked questions about Eliquis. Can I drink alcohol while taking Eliquis? It is generally safe to consume alcohol in moderation while taking Eliquis. However, excessive alcohol consumption can increase the risk of bleeding. It's important to discuss alcohol consumption with your healthcare provider. Can I take over-the-counter pain relievers while on Eliquis? Some over-the-counter pain relievers, such as nonsteroidal anti-inflammatory drugs, NSAIDs, can increase the risk of bleeding when taken with Eliquis. It's important to consult your doctor or pharmacist before taking any new medications or supplements. How long should I take Eliquis? The duration of Eliquis treatment will depend on the specific condition being treated and individual factors. Your healthcare provider will determine the appropriate duration of treatment for you. What should I do if I miss a dose of Eliquis? If you miss a dose of Eliquis, take it as soon as you remember. However, if it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Conclusion: is Eliquis right for you? Eliquis is a widely prescribed medication used for preventing blood clots in individuals with atrial fibrillation and reducing the risk of blood clots after hip or knee replacement surgery. It offers several benefits, such as superior efficacy in preventing strokes and a convenient dosing regimen. However, it's important to be aware of potential adverse effects and take necessary precautions to minimize the risk of bleeding. Before starting Eliquis, it is essential to have a detailed discussion with your healthcare provider to determine if it is the right medication for you. They will consider your medical history, individual risk factors, and potential interactions with other medications to ensure your safety and well-being. By understanding the common purposes, benefits, potential adverse effects, dosage guidelines, and dangers of Eliquis, you can make informed decisions about your health and work together with your healthcare provider to achieve the best possible outcomes.